Laura is the Executive Director at Georgians for a Healthy Future, a nonprofit consumer health advocacy organization that works to advance access to quality, affordable healthcare for all Georgians through education and outreach, coalition building, and mobilization and public policy advocacy. Laura has an MPH from Emory University, where she focused on health literacy and social determinants of health. Before moving to Atlanta, Laura attended the University of Georgia, where she earned her degree in kinesiology with a focus on biomechanics. She's also a master certified health education specialist. Laura came to Georgians for a Healthy Future in June of 2014 as the community outreach manager. She currently serves as a consumer liaison representative to the National Association of Insurance Commissioners and sits on the Georgia Department of Community Health's Medical Care Advisory Committee. Thank you so much, Laura, for joining the discussion and sharing your experience with us here today.
Yeah, thank you for having me. My bio makes me sound more impressive than I am. But I'm very pleased to be here with all of you Tennesseans this morning. I grew up in Bowling Green, Kentucky, and then moved to Georgia for college. So I have always been a next door neighbor of Tennessee, spent many long weekends, vacations, traveled through it many times. So I have a fondness for you all's state and have spent a lot of time there. So thank you for having me this morning. I am going to share my screen with you all because I do have a few slides that will kind of help me, I think, tell the story of, how we got our surprise billing legislation done here in Georgia. As Margaret said, I work for Georgians for a Healthy Future. We are a kind of a peer organization to the Tennessee Healthcare Campaign. So, you all probably have a decent understanding of what we do, but we really focus on consumers and on, passing laws, changing systems and policies so that consumers have more affordable, accessible, higher quality healthcare so they can live healthy lives. Our story here in Georgia is, it stretches over about 5 years. I came to GHF in 2014 and we started working on this issue in 2015. So we've worked on it my entire time at the almost my entire time at the organization. I will, abbreviate some of the pieces of this so you guys don't have to feel the pain that I felt for 5.5 years. But in 2015, GHF does all of our work in partnership with other organizations and groups. So we have done the majority of our work on surprise billing in partnership with our peers at Georgia Watch. They are also an advocacy organization, and they work a lot on financial protection issues. So surprise billing was of interest to them because of the financial implications that come from surprise bills. So we came together with Georgia Watch in 2015. We hosted a policy forum on kind of health insurance cost, out-of-pocket costs, we called that forum getting what you pay for. So we talked about surprise billing, we talked about network adequacy and kind of how those things impact consumers' wallets after they've been paying premiums for health insurance. We had a really strong start. We used that year and that policy forum to really build awareness with our state legislators and with the public and with our partner advocates around these issues of network adequacy and surprise billing. In 2015, our legislature felt like these were such important issues that they put together a study committee. So that committee met from kind of the end of our 2015 legislative session to the beginning of 2016. It was clear that they weren't quite ready to act at that point on surprise billing. So instead, what they did was take up kind of a more minor bill, but very important, that required our insurance companies here in Georgia to publish accurate and accessible provider directories. And for those of you who don't spend your life thinking about health insurance, and that is the way people should spend their lives, provider directory is your list of providers that are considered in network by your insurance plan. So, we in Georgia Watch worked together to get that successfully passed in 2016 and really thought of that as kind of a first step towards addressing both network adequacy and surprise billing in Georgia. after that, in 2016, we saw the first surprise billing bill introduced in the Georgia legislature. The bill was a bit messy. Nobody liked it. Consumers didn't like it. Insurers didn't like it. And providers didn't like it. But it was a first attempt by our state leaders. In 2017, what we started seeing happening was, and actually Senator Watson, your story about Tennessee is very familiar for Georgia. In 2017, we started seeing the House would introduce a bill that was a little more provider friendly, or excuse me, insurer friendly, and the Senate would introduce a bill that was a little more provider friendly. And these two bills would each pass their respective chambers each year, and then they would go nowhere in the opposite chamber. So every year the House passed its insurer-friendly bill, and the Senate would not take it up. Senate would pass its provider-friendly bill, and the House would not take it up. And this just went on and on. And in 2019, we kind of, GHF and Georgia Watch just kind of threw up our hands and said, we're not weighing in this year unless there's a different approach. So as Margaret mentioned, I'm a consumer representative to the National Association for Insurance Commissioners. There's a group of about 30 or 35 consumer representatives that are kind of formally appointed to advise that body. And through that work, I had built a strong relationship with some folks at Georgetown University Center on Health Insurance Reform. So they began a program in 2019 to kind of assist states and the federal government with surprise billing issues and trying to really help states find a solution to the issue. So I want to go back to this lovely stalemate GIF. Our stalemate here in Georgia was not as cute as these adorable dogs that are holding on to the tennis ball. They're the cutest. Our stalemate was much less cute. But so what we did in Georgia was we, when Georgetown kind of announced this technical assistance program, I chatted with our partners here in Georgia Watch about, could they kind of be a neutral facilitator that might get our House and Senate to approach the surprise billing issue together and differently than we had in past years. So we agreed that that was a good approach to go, and Georgetown agreed that they would be happy to be involved. And so we are Georgia Watch and Georgians for a Healthy Future. We share a contract lobbyist, Andy, and he just did some amazing lifting on this effort and really navigated this well. And so I full credit to Andy for doing a lot of the heavy work here. But Andy went to kind of the two leaders in both the House and the Senate that had been in charge, kind of leading the charge on surprise billing in their respective chambers. He said, would you guys be willing to have kind of a closed door process where it's the two of you, it's the consumer folks, and there's a neutral kind of facilitator to help develop the legislation or to develop a solution. And, we had spent really the last 3 years, building these relationships, building trust, trying to, be a resource for those legislators. And that paid off in this moment where we, approached them about this time, well, a little earlier, so about 1.5 years ago now, to say, would you do this with us? And they said yes. So essentially, we brought everyone into a closed door room. We agreed that everything that happened in the room would stay confidential for the time being, and that, providers would not get to know about it. The insurers would not get to know about it. We were going to co-develop something. So Georgetown University experts came down a couple of times to kind of meet and kind of build the legislators' understanding about like what are the possible paths forward and solutions that are available. So they came down twice, and then we started developing the legislation with, again, some input, data, and support from Georgetown. They did not advocate a specific approach, but just, offered data about different approaches. So they were very neutral. And then, GHF and Georgia Watch were really put consumers at the center of all of the discussions. What's best for the consumer? And And so luckily everybody kind of kept their promise of confidentiality. We came out of that process with a strong, comprehensive, consumer-centered bill. And that bipartisan that bicameral approach, once we were a little more public about it, attracted the attention and support of the governor. And so at the start of the session, we had a plan to introduce the same bill that we had developed in both the House and the Senate, and start the process. And the governor was impressed enough that he put his support behind it. And so when those bills were introduced, and when inevitably both the insurers and the provider communities were not 100% on board with it, there was enough support already in leadership for this to continue moving forward despite a little bit of opposition from those stakeholder communities. And what I would give our governor credit for, really, his team really did a lot of kind of blocking and tackling of some of the major objections from those communities. And in past years, both providers or insurers would have kind of put a stop to this legislation. At some point would have been able to kind of slow the process enough so that it couldn't get passed. But, with luckily a very clear-eyed focus from our legislative leaders and the assistance of the governor's office, we were able to get that legislation passed with very few changes. There were a couple of tweaks around the edges. But that's kind of how we got it done. Is we built these relationships. Early on, we shared data and consumer stories. We built an understanding amongst our legislative leaders about why this was an important issue. We had those trusted relationships, so these leaders kind of went along with us on this issue and are on this process. And once we got, a bill that everyone agreed on, there was just a real laser focus on what was best for consumers. Let me check my time real quick. But on my next slide, I've got just kind of a rundown of what's in our bill. I won't go through all of these, but it does cover emergency and non-emergency services. Our legislation is a bit of we call it a split the baby approach. So insurers have to pay providers for the emergency and non-emergency services promptly. And there is a kind of a greater of approach written into the bill. So the insurers have to pay the greater of the verifiable contracted amount paid by all insurers. So essentially a median contracted amount, or the most recent amount agreed to by the insurer and the out-of-network provider, or a higher amount that's that the insurer finds reasonable. So whatever the greater amount of that is, the insurer has to pay that to the provider or facility pretty quickly after either an emergency or non-emergency service. And then if the provider doesn't feel like that payment is high enough, then they can initiate arbitration. And at that point, the consumer is left out. The consumer is only eligible for their out-of-pocket costs in either emergency or non-emergency services. So whatever those out-of-pocket costs that are outlined in their insurance plans, that is what they're responsible for in both of these situations. There are also some provisions around kind of consumer choice to go out of network, and how consumers are notified about whether they are about to be out of network or might be referred to a provider that is out of network. Georgia is still in the rules and regulations process, so this bill does not go into effect until January 1. So the consumer choice and notifications piece is still a little bit in flux. And that is my biggest concern moving forward, is if the rules around that notification piece are too lax, then all of a sudden there's a big, gaping hole in this law. So we are keeping a very close eye on that and weighing in on the rules around that. That's also an issue that came up in Texas. There is a pretty well-defined arbitration process for payment disputes that I've kind of outlined here. And then we got a bonus feature in our legislation. Georgia does not have an all-payer claims database, which is a really helpful tool that about 19 other states use, and they gather payment and usage information from all kinds of health insurers, and they can use that to make kind of evidence-based decisions about healthcare cost growth, population health, service usages. So we are extra pleased that that piece was built into our legislation. And then I'll just point out, our legislation is not perfect. The enforcement piece of this allows our insurance commissioner to report providers who kind of continue to violate this law by balance billing consumers to essentially our physician workforce board. And we really wanted the insurance commissioner to report them to the attorney general, which has, of course, more legal grounds to hold them accountable. Our legislation does not cover ground ambulances, so we will have to go back and address that at some point. And as I mentioned, the consumer notification piece is still kind of TBD, so we are keeping a close eye on that. And Georgia still needs federal action to cover our large employer groups and air ambulances. But I'll leave it there. I hope that Georgia's story and path forward has some lessons that Tennessee can take from it. It sounds like you all are dealing with some very similar dynamics, but it also sounds like you guys have a lot of some key pieces and some very smart folks here to help you navigate to hopefully a solution. Thanks for having me.
Yeah, thank you so much, Laura. I think that was really informative to hear from how that process has worked for you. I was wondering, did this come up at all in your legislation, or is there any piece in the Georgia legislation to protect consumers who actually do not have insurance? I know there are some parts of legislation that have allowed uninsured folks to bring disputed bills to arbitration. Is that something that came up in your discussions?
That did not come up in Georgia. So we only kind of looked at folks who are privately insured in our state benefit plan, small group or individual coverage.
Gotcha.